Waterfront Recovery Services will soon be celebrating our 3rd anniversary. We're proud of the progress made in these last 3 years, working to establish the first medically based substance use disorder facility on the North Coast. From the beginning, our goal has been to deliver a higher standard of care and to make a lasting difference in the lives of some of the most vulnerable in our community.
So Waterfront Recovery Services is a component of Alcohol Drug Care Services. We are a 56-bed medically managed residential treatment program and detoxification center. We have 20 beds of residential detox and 36 beds of longer-term residential. So that's for folks that would need longer-term care for stabilization. We have some extraordinary community partners, primarily St. Joseph's Hospital.
The St. Joseph Hospital, through the Wellbeing Trust grant, was really able to provide that operating support to have Waterfront open its doors and to subsidize operations for the first 18 months.
Prior to that, we had received IMS certification, which is Incidental Medical Services. That allows Dr. Ruby Bayan to be our medical director. Originally, she was scheduled for 15 hours, but that turned into a full-time position. And then ultimately, we have also hired a full-time nurse practitioner. The acuity of the clients that we serve coming off the streets or criminal justice referred, many of them have multiple issues, mental health issues that have been unaddressed, obviously chronic substance use disorder, as well as medical problems.
One challenge that we have in Humboldt County, and just being a rural community, is that we often lack facilities, and we have lacked that kind of investment in infrastructure and different facilities in our community as compared to some more urban centers. So John long had a vision to create a higher level of care and to transform from a social detox to a medical detox in preparation for drug Medi-Cal. But it was hard to find a facility and the additional funding in order to start that up. So when Providence Health and Services and St. Joseph Health merged in 2017, there was the Wellbeing Trust was created, and that's a new national foundation, and they had set aside a certain bucket of money, $30 million, to invest in California mental health needs. That came about in late 2016, early 2017, right at the same time when John was exploring opportunities to transfer the social detox on C Street to a medically managed detox. At the same time, there was a tradition with what we had known as the MAC building that was serving homeless families and chronically homeless individuals most recently. And federal funding for those programs were going away. So the city of Eureka was going to have a building that was going to have no program in it. It was going to be sitting empty. And a group of people got together and decided that if the stars could align, we could create a model where John could realize his vision and work with Dr. Bayan to bring a higher level of care for alcohol and drug addiction to our community. And at the same time, the city could find a use for their building and really meet community needs. That was going to be better for everyone, better for the patients served, but also better for the overall community, that people could get into treatment when they wanted it.
I used to be incredibly frustrated at C Street. We would have people coming in, and like I said before, they would go via ambulance. If they needed mental health services, which 90% probably did, I could not get them into the local mental health services because the wait's too long. So I was unable to successfully treat these folks. So when we have Dr. Bayan there, who used to, she had worked at Kaiser setting up Suboxone programs. She was the head of county mental health. She was their medical director. A lot of times she might know the patient. She might be able to have some history, or we would request history, so she could dial in the medications during the detoxification process for stabilization of the clients. That is invaluable
That was a game changer for our community. Prior to that, we had a 9-bed social detox model that every patient that went there had to first go through the emergency room to be cleared. And the emergency room really isn't the best place for people who are suffering from addiction to go for treatment. It's where you go if you have a life-threatening acute illness or accident, but it's not the best, it's not set up, and it's not designed to treat addiction. So having Waterfront Recovery Services in our community that can really meet people's needs, people who are suffering from addiction, is so valuable.
It doesn't benefit anybody if people are detoxing and they're ill, they're sick, and they leave sick. They haven't slept. So working with Dr. Bayan, she's created medication protocols for methamphetamine, for opiate use disorder, for alcohol, for benzodiazepine, but designed to keep people safe and keep them comfortable. So that combined, the difference is night and day.
We know that treatment on demand is the best course for dealing with the opioid epidemic and the other drug epidemics that we have in society today. Across the country, we know that we need more access to care, and providing care to people when they want it is the best for everyone.
So the difference that you see in from day 1 to day 3, using Suboxone to detox, using the medication protocols that she developed. So people that would normally be dreadfully ill are better in 2 to 3 days. Sometimes with alcohol, it takes a while. But the difference is incredible. The stabilization that she can provide, that our nurse practitioner, Jackie, can provide. Having medical staff, RNs there to monitor these folks, having detox technicians trained by Dr. Bayan. It's a different world now.
Dr. Bayan's a tremendous asset to this community and to Waterfront Recovery Services. They wouldn't be able to do what they're doing without her. Her skill set of being an addiction psychiatrist and a child psychiatrist blends that often co-occurring addiction and mental health into one package. So when people go to Waterfront to get cleared for detox, she can evaluate their addiction status, their detoxing status. She can also evaluate their mental health condition in addition to their physical health. And so really it's all those things happening at one time. It's a great example of whole person care. The way that our current system is designed and funded, oftentimes dollars and funding for substance use come into one bucket, while mental health conditions go into another bucket, and they don't overlap. But we know that people aren't either one or the other. We're complex. There's a lot of gray. It's not just black or white. And so what Dr. Bayan is able to do is really treat the whole person and provide the needed care for individuals that are really suffering from substance use disorder and or mental health conditions.
When Dr. Bayan and myself designed a medical program, have it up and running, she wants medical records. She wants to understand the patient that she's working with. As much information as we can get allows us to do our job better. People are not used to that in the community, referral sources. And what we need to get away from in this community is pushing people into an inappropriate venue to treat them, simply to move them around, simply that they're off your caseload and now they're here. We need an effective door to walk through for whatever type of treatment that you need. That's one of the reasons Dr. Bayan and myself are pushing for the crisis triage unit. So if somebody didn't meet medical necessity criteria because their mental health issues were too severe and overrode their substance use disorder, if it was a 75-25 split and 75% is mental health and 25 is substance use, then we could take them to a crisis triage, stabilize them, and then bring them back to treatment. We need those things in this community. So for us to get there, people need to pull back and look at the broader picture, look at where the gaps are, and do an objective analysis of it, other than rigid adherence to the old way. We're failing in the old way. and we need to move forward. So that takes investment. That takes a financial investment. That takes training.
We get them through the acute phase of detox, which can be quite challenging and precarious for their health. We get them over that hump, and then we start working on all of the other aspects. So health first, and then secondary, we start, setting up goals for a living environment.
The work we can do is amazing. The outcomes, people transitioning and completing the program are much higher. People on longer term medication assisted therapy, they have a better chance of reintegrating with their family and living a better life. And that's hugely important, which is a modification of the view. That's a tricky one in the community, because medication assisted therapy in some quarters is looked down upon as still using. And at Waterfront, we don't believe that. We believe in your life improving. If your life improves and you leave and you can work and you can hold down a job and you can keep your family together, you're good. We've achieved what we needed to achieve.
I came into this program not knowing what to expect, and what I got out of it was so much out of this program. I mean, I got my family back. I got my self-esteem back. I got ambitions. I got goals. I have my whole future ahead of me. And, before I was just existing. Now I'm living. These programs are really to change people's lives.
Well, there's multiple community benefits to this. One is community well-being and public safety. For the clientele we serve, 70% roughly are homeless, living on the street. Any addiction that you have, you're going to need to feed it. How are you going to get that money? You're either going to steal, you're going to break into cars, you're going to do whatever it takes, especially if it's a heroin habit or a methamphetamine habit. So a large part of this is misunderstanding in the community and at large, I think, about what's going to solve this problem, what's going to have a lasting impact. Arrest and incarceration may be great, but if that worked on its own, we wouldn't have a problem. The people we deal with have been arrested multiple times, several of them, a huge percentage. So what we want to do is provide stabilization, treatment. And when you graduate our program, you leave to housing, primary care physician, medication-assisted therapy. What we want is to improve our clients' lives, which will in turn improve the lives of community members. It just does. The impact on that one individual's family, if they have family, less crime. It's multiple effects to this. We also work really well with the county of Humboldt, Department of Health and Human Services. We work with, Chief Watson put together Officer LaFrance and Officer Swanson, who are amazing people. They're amazing human beings, and I can't compliment them enough on the partnership that we've developed, the trust that they have with the homeless and drug-addicted community. And they know they can access help through those officers, and we have a fantastic partnership, them bringing us folks that are most desperately in need, and they do it well. And we work really, really well together.
Waterfront's one of our key partners within CSET. So we're looking at underlying causes of problems, addiction, mental illness, and trauma, and Waterfront provides a huge resource for us for getting people to detox and also residential treatment.
Last year in July, they actually lost funding for Waterfront, and there for a couple months I couldn't be putting anybody into a residential or detox or anything like that. And it had a major effect on the work that I do, because a lot of the times the people that are suffering from addiction are also suffering from mental health issues. Well, you really can't tackle one without tackling the other.
Arrest and incarceration is, if it worked to cure this problem, we wouldn't have anybody out in the streets. It doesn't. it's not what's needed. Treatment and stabilization that we provide at Waterfront are what's needed, and working hand in hand with law enforcement. The city of Eureka is one of our primary partners as well, and I want to really say thank you to Uplift and the Community Resources Department, which used to be Parks and Recreation. Miles Slattery's team there is fantastic. The Uplift team, they work with our clientele to put them back to work, resume building, all of these things, and they're really successful. They're incredibly successful. So not only do our clients, we may have homeless clients that come in, we stabilize them, we get them ready, and then they work with Uplift. Uplift can get them a job. If they transition to housing, that's two things that are incredibly important: to be self-sustaining, to be reintegrated with society. That's our job. That's what we want to do. Bring people back on the team. And Uplift and Miles's team there is fantastic.
I think the biggest benefit to the community is basically having the community stop the stigmatism of these individuals who either have addiction issues or mental issues or any sort of, houseless situation. There's always been a stigma related to that, some sort related to crime. We're trying to make it clear that these are community members, and as community members, they can be just as valuable as any other community member.
The issues that are facing our communities today are big. They're significant issues, and it really is going to take all of us working together in order to change systems and to create the type of healthcare and social care system that we want for our family and our neighbors. And so I think partnerships like what Waterfront Recovery Services has done, and partnering with the county and St. Joseph Health and others, police department, sheriff's department, it really is going to take all of us working together in order to be able to address these issues that our community is facing.
Us being successful at our job means that when people leave the program, they're not just not using and just miserably going about their day. What we want to instill in people is a love for life, like to reattach to life. Life is amazing, like keeping yourself healthy, feeling good about yourself, working a job that you like, pursuing something that's satisfying to you, eating great food, having sex, love, relationships, all of those things, and being able to do it without destroying yourself, being able to do it in as healthy way as you can. Those are the things that build the foundation for giving back to the community. Because once you've put that into your own life, you know how to share it. And that's what we want. That's what we want for all our clients. To go out and vote, to go out and participate in creating a better world. That's why I do what I do. That's why I love this, because I don't feel like I'm responsible for anybody getting better or anything. I could say Dr. Bryan is responsible for people getting better with medication adjustments and things like that. But it is the most amazing thing to watch somebody come in devastated and broken, and then 2 years down the road, oh my God, I'm in college. 4 years down the road, they graduated college. They're getting a master's degree. 6 years down the road, they're in a job in the community helping people. It's like substance use disorder, alcoholism touches everybody. And knowing that there's hope out there for people, true hope, that we're going to bring your child back, that your dad can come back to your family or your mother, that the kids are going to have real parents that break the cycle, that don't, that this isn't all there is to life. We just want people living better lives, understanding how to live a better life and pursuing it. If we can instill that in people, it's fantastic. So.